The spate of stroke the world over is increasing at an alarming rate, most especially in African countries like Nigeria. In order to intervene in the growing rise in stroke cases, Rise Clinic, in collaboration with NEUROSURGERY Specialist Hospital, National Hospital Abuja, and NORTHBAY Medical Center, US, recently organized a 2-day training workshop on stroke management, tagged Stroke, Burden in the Society and the Way Forward.
Education and healthcare is required for any economy to grow. True or false? If you agree, please show your hands. Education and healthcare is required for any economy to grow, but unfortunately, it is not yet priority here in Nigeria. That is why we have our teachers and our healthcare professionals underappreciated. But guess what? We want to tell you that as long as you're open-minded, you're willing to be transparent in the collaboration which we'll ask you for, we'll hope to see a new dawn in healthcare practice in Anambra State. Education creates some awareness that hopefully does not stop in this room today. That when we get back into our communities, we pass down that knowledge, we pass down that training, we pass down that education. Some of you know, there is the common saying, Nako mother stroke. Yes? How many of us in this room believe in Nako mother stroke? Don't be shy. So Nako mother stroke, Dr. Zussman, I asked the question, how many of us in this room believe that you can send stroke from your house to someone else's house and they get stroke? And I don't see any show of hands. I know some of us believe it inside, but we know we're amongst professionals, so we don't want to admit it. But it's okay. That is where the education comes in. Stroke myths, cultural biases, religious biases. If we don't start addressing them, health illiteracy is going to thrive and people are going to continue to die meaningless deaths.
Stroke, also known as cardiovascular accident, CVA, is the damage to the brain through interruption of its blood supply. The disease condition is enshrouded in lots of myths and traditional beliefs to the effect that most times even the survivors and their loved ones resign to fate due to their lack of knowledge about the disease.
For it to say that stroke has occurred to anybody, it means that the person must have suddenly lost a neurological function. Okay? So either that neurological function is localized to one part of the body or is involving virtually all the parts of the body. And it must be sudden. And then when you trace the origin, you find out that it's of a vascular origin. And again, too, it will have lasted more than 24 hours or sometimes leading to death. That's when you say that stroke has occurred. So like if somebody who suddenly develops weakness of one part of the body, maybe the hands and the legs, or the mouth starts moving to one side, or the person develops difficulty with speech, okay, and sometimes it can even lead to loss of consciousness. When this kind of thing happens suddenly, you are bound to say most likely that stroke has occurred.
Even though the myths associated with stroke are commonplace in our climb, the fact is that there are lots of factors that can increase the likelihood of stroke.
There are many causes of stroke. In terms of etiological factors, there are many causes. Okay, you have some factors that are there, you can do something about them. Those ones you say that are modifiable. You also have some factors that you can't do anything about. Those ones you say that are not modifiable. So let's start with the non-modifiable factors. So something like age. Stroke can occur to any age group, no doubt, but it's actually commoner in the older group. But it can occur to anybody, even the baby in the womb can have stroke. Even the little child that was born today can have stroke, but normally stroke is commoner in the older age group. Now, we talk of sex, we talk of race. For the black man, stroke is commoner to the black man compared to the white man. Then for sex, it's commoner in males compared to females. Now, something like family history. Okay, when somebody has either the mother or the father had a history of stroke, okay, that's a very big risk factor. It means that there may be a predisposition to the person because of the family history. Okay, but when you come to the modifiable factors, you talk of maybe sedentary lifestyle, talk of obesity, talk talk of hypertension, talk of diabetes, talk of abnormality of lipids, okay, and many other factors, even cigarette smoking, even alcohol, okay, all these things can actually predispose to stroke. And then sometimes in the younger age group, abuse of drugs, which is very common presently, abuse of drugs. Okay, especially the psychoactive drugs that affect the brain can actually cause stroke.
In order to ensure the participation of relevant stakeholders in the workshop, a house-to-house sensitization and fact-finding visits to the homes of some stroke survivors were carried out by the organizers of the event.
Around the 12, the near midnight and that day. I can't be sure. I don't call La Broom. Now, but I have a channel with La Broom, La Hall. But I would take a bit to two. My when I toilet, that one, miniature toilet, no matter. The five do run, the one thing. Papa, toilet, na marry up. She neck and every home moves say, I know, a jet toilet. I can't, I'm a papa with first. You can't be the second one. Yeah, they just did a tag. You did the way by a toilet. Which answer? No, mamma, I force her. Papa, never can laugh for. Papa and the third one. Hey, she neck and I'm a home in Fenka. We just you know about Polongari. Yeah, Dagaropa. Lady can walk. Yet to walk us then. I can see J. By far, Bishop was the by then, if I name only with his Yaka to 5. Bishop was the third one, Papa, 3 run. They didn't have the man. I don't know the man. No, I was like every 5 o'clock. Yeah, before I was in Naka. Now, so come on, and see Jesus. Not for my body, not with her. And that's not in you're not strong, not in, yeah. Or stretch out or chat. Yeah, I cannot be my way. Then the end to come to eyes. Wait here. I'm going looking at one way, what some organ. Stand up with her who made me. Vanity. I was not be around the bed if I get boy. One also, not that's the nature of na sugar and they too much. People are too much. If a sugar number 280 sugar though. 180. Yes, no, I no one to talk about one back into the small from off. Stand off from Woburn. Now, before my sister, I'm going to work just a short motor. That is the most of the hospital. Yes, I use the hospital. Doctor secretary to go to sugar, caught that. If I was if I am.
And what I'm saying, only that now, Nick and listen. Mazeta, me a call this. Where the come can't say. No, lose there after 7 days. For them to the Kibo. More about ever 5 yeah. More Eba obele wee mata abịa onye abịa kwuo nke ejem onye akwuo nke ejem wee ndegide etu a ruo etu a ife ndizi after ya bụ ebe mmeje ka ọ dị mma. That's all.
The signs and symptoms of stroke can vary from person to person depending on the region of the brain that is being deprived of blood due to blocked vessel. These include dizziness, sudden loss of vision, problems with balance and coordination, among others.
There is a very simple method of knowing if somebody is about to suffer a stroke. It's called FAST. The acronym is FAST. F stands for face. Now, if somebody, maybe when you ask the person to smile, or you ask the person to close his eyes and the person is unable to do that, or maybe when the person tries to smile, you find out that he's moving only one side of the face. That is one. Then you have A. A is the arm. When you ask the person to maybe raise your arm and the person is unable to do it, you begin to suspect that. Then you have S, which is speech. Maybe the person tries to talk, there is a slurring of speech, or the person has difficulty in pronouncing words or repeating words. Then T is time. Usually, like I said, if it is more than 24 hours. Now, there is also what they call, there is a 3-hour window. In case the person suffers a stroke, the person has to get to the hospital within 3 hours, for it to be taken care of, and for it to, a greater chance of reverse of the disability.
Strokes are life-changing events which can temporarily or permanently affect its survivors physically and emotionally. This can be managed through rehabilitative activities.
Stroke is a far-reaching and very serious medical condition. As life expectancy increases on the continent, we're going to see more and more stroke. As risk factors increase, you heard what's the number one risk factor for stroke in Nigeria? Number one, hypertension, right? And we have a treatment. If we give a medicine like lisinopril, the cost is $15 a year. We can treat hypertension for $15 a year. Do you know what the cost is of this baby aspirin? This is a whole year's supply, 81 milligrams. It's a whole year's supply. It costs 500 naira. 500 naira. So the cost of a few cups of coffee, and you can prevent stroke for any patient who's had a TIA. And they don't have to have the suffering, and they don't have to have the death from stroke. So what I want to say is this group right here has the expertise, is representative of all of the stakeholders in this system. And Amaka and I had a wonderful opportunity to meet with one of the advisors to the governor of Anambra State. And when I was in Abuja 2 days ago, we heard from the Minister of Health for the country. And there's a will to take forward a proposal from groups like this to even make Anambra State the first. Make Anambra State the first in Nigeria to develop a stroke program that grows based on education, based on clinical best practices, and then map onto that.
One thing I have to say is that there's no need to associate stroke with any stigma, because like I said, stroke is treatable. The earlier the better. But yet it's actually true that if you're on treatment for a post-stroke event, sometimes it involves a lot of things. Sometimes there may be need for speech therapy, for physiotherapy, for occupational therapy and all that. Okay? But then these things are doable. Let's say, for instance, somebody that was talking with you suddenly starts developing slurred speech, or somebody wakes up in the middle of the night or sometime and saw that he has weakness of either the hands or the legs, and then but the person is still able to talk with you. This person is still able to reason, comprehensively. His level of understanding is still intact. That one most likely may be what we call transient ischemic attack. Okay, so if it resolves within 1 hour, then the person can take low dose aspirin. In fact, the common ones that we use is vasoprene. That's about 75 milligram aspirin, which is a very low dose. So when you now take it, okay, you swallow 1 tablet and then you seek medical attention as soon as possible. But if the person that develops that weakness, okay, that develops either weakness of the hands or legs with slurred speech, suddenly loses consciousness, please do not give aspirin, because that one may actually be the bleeding type, the hemorrhagic type. So in that case, if you give aspirin, it won't be to the person's interest. So you take the person to the hospital. But like I said, the best is to seek medical attention as soon as possible.
There is no gainsaying the fact that Rice Clinic is leading in the campaign against the high prevalence of stroke in the state and Nigeria. But the collaborative efforts of people from all sectors of the economy will contribute to drastically reducing the dangers posed by stroke on the populace.
The two-day stroke workshop was organized to educate our people about stroke management, the challenges in the society. However, it's one of the preliminary steps of going on to a longer-term solution for stroke. So we called in healthcare providers, people in the community, to tell them about the disease, provide basic education, and get them to understand what kind of care is available out there. But like I said, all of this is a preliminary to setting up a statewide stroke care coordinated program that can allow people at all levels of care to participate in the solution and can allow all people at all levels of socioeconomic status to benefit from the stroke care.